Uh, so the final exam is 30%. Quizzes, we have two quizzes, quiz 1, 5, and quiz 2, 5. Case presentation, 10. 10 also for case report. CPL presentation also 10%. For the OSCE, originally it is 30%. But due to this situation, we cannot have in-person OSCE. And because of that, we cannot have 6 stations as usual, like before. Therefore, we suggested to reduce the OSCE contribution to 20% instead of 30, and take 10% as a pre-OSCE, like a comprehensive quiz. So toward the end of the semester. Okay. Any question before moving to just few slides about pharmaceutical care plan? If you have any question, you can just click raise your hand, or you just write the question in the chat, or just use your mic. Okay. So the pharmaceutical care. Okay. What is the pharmaceutical care? Can you still see the slides?
Yes, sir.
Yes, sir.
Okay, it's fine. So the pharmaceutical care is where the pharmacist, usually clinical pharmacists, will be involved in care of the patients. So this is the pharmacist patient care process. So the care is a process, although it's step by step, but again, we will back to the beginning. It starts with collecting the data from the patients. As you can see, collect first in yellow, and then to assess the data you have. Plan for your goals, implement, meaning give the therapies or non-pharmacological intervention, then follow up and evaluate. Then again, in the next visit or next admission to the hospital, you will collect again the information, assess, and do the cycle again. So first part is collection of the data. Usually it started when the patient came to the hospital. So the pharmacist in charge will take the past medical history or relevant information related to the patient condition. Demographic information, for example, is essential, and also if the patient underwent any surgery, if has any other problem in addition to the current problem he is coming for. Medication, past medications, um, if he experienced any side effect. So whatever information, the patient lifestyle also, the patient is smoker, non-smoker, alcoholic, etc. Sorry. And then the pharmacist will group this information, okay, according to the relevancy of this information related to a particular disease. For example, all information related to diabetes, okay, will group in one section. Also, another group of information related to the patient, if patient having asthma, for example. So after you collect all the data, you need to assess, okay, now what are the problems this patient currently have? You will list the problems, and you have to know the priority of the problems. Which condition must be treated first? Which is the most urgent problem with this patient? And what are other conditions that the treatment can be delayed and can be treated later? So knowing the priority of the problems with the patient is very essential to plan. Now, after you gather the information, you will assess, for example, this patient has uncontrolled diabetes but well-controlled asthma. in addition to back pain, whatever. So you will list the problem and then you will put your plan. First, you have to know your goals before you go to the therapeutics. Okay, so first one is to put your goals you need to achieve. Of course, for example, for chronic diseases like diabetes, we don't aim to cure the disease because these diseases are not curable. Okay, we try to prevent, for example, complication and also uh, prevent progression of the disease. Whereas if you have an infection, your goal is to eradicate the microorganism and also treat the infection. So you put your goal first, depends again on the patient condition. As I always say, there is no one size that fits all. So you need to individualize. You need to individualize your goal based on the patient condition. For example, you will have two patients with the same medical condition, both of them having diabetes and asthma, let's say. But one of them, for example, is elderly, above 80 years old, while another one is only 50 years. In elderly patient, we don't expect too much. So usually our target are less strict compared with other populations in terms of controlling the blood glucose, because the benefits, not really, if we target very low level of HbA1c related to diabetes, the benefits of obtaining these may not outweigh the risk for side effects and also in addition to other problems with the elderly. So in these patients, we will not be very strict, for example. But in younger patients, we have to achieve, for example, HbA1c 6.5. Same applied also to other patient with risk factor. If you have two patients, one has risk factor, but the other one does not have any risk factor, only having a particular disease. So in this case, those who have risk factors, you have to be very strict, and also you have to, for example, give aggressive treatment, starting with dual therapy instead of one medication. So again, it depends on the patient condition. After you plan, you need to also plan how to implement. What is the best treatment for this one, for this patient? Do we need, for example, IV treatment in this patient, or do we need, for example, oral is enough? Okay, is urgent treatment indicated in this patient or not? And then after you implement all the treatment you believe will uh, improve the patient condition and quality of life. Of course, usually this is a teamwork. Not only you as a pharmacist will do that, usually in collaboration with other healthcare professionals, nurses, physicians, and others. Okay? And then you will plan your follow-up. Okay, you need to differentiate between monitoring and evaluation. Monitoring, you just put the parameters you want to monitor. Usually parameters are either lab data or sign and symptoms clinical presentations. For example, in patients with diabetes, you need to monitor the blood glucose, HbA1c, renal profile, and other related parameters. On the other hand, also, you need to monitor if the patient experience any sign and symptoms of hypoglycemia. Okay, you need to educate the patient, of course, about these sign and symptoms. This is the monitoring. After that, you need to evaluate. Based on your monitoring parameters, then you need to evaluate whether you achieve your goal or not. This is the most important question. Do you achieve your goals, the goals you put from the beginning? Have you achieved or not? If not, so you need to again assess why your goal weren't achieved. Is it because the patient is not compliant to the medication, for example? Is it because this medication is not effective or it's not enough, or the patient does not know how to use, for example, the inhaler of the asthma? So different reasons may lead to failure of treatment. Then again, you will collect the data, assess, plan, implement, and then monitor and evaluate. So this is in brief about the pharmacist care process. Do you have any question? Okay. When when we are when we are online, just we feel that we are talking to ourselves. So if you have anything to interact, that's fine also for me. Okay. Usually I always use this slide at the beginning because there are some definitions. I noticed that students may get confused and also the definition is not clear for them. The first one is an indication. What do you mean by when we say this medication is indicated? An indication is the reason for which you will give a medication, whether it is for therapeutic, prevention, or any other purposes. Okay, so this is the indication. Contraindication is exactly the opposite, where the patient has a condition in which the medication shouldn't be used. Why it shouldn't be used? Because the risk outweigh the benefits. Okay, even if the medication is indicated in this patient, for example, let's say this patient having diabetes again, and metformin, of course, is indicated for patient with diabetes. But if the patient having severe or advanced renal problem, creatinine clearance below 30, so metformin must not be used because it increases high risk for acidosis. So the risks outweigh the benefits. So because of that, we say it's contraindicated. So indication and contraindication. Third one is caution. Also, I noticed that students may uh, confuse between caution and contraindication. Caution where you can use the medication, but with caution. You will read this frequently in special population. For example, like pregnant women, breastfeeding, elderly patients. So you can use the medication, but with close monitoring. It does not mean that you cannot use, but you can use with caution. Example for is beta blocker in patient with diabetes. They may mask the symptoms of hypoglycemia. Because of that, it's better to avoid, but it can be used with caution. Just you need to make the patient aware of that. Adverse drug reactions. It's a response to the medications, which is noxious and also unintended. Unintended. So the effect of the medications in this case happened at the doses normally used for the prophylaxis or diagnosis, meaning in normal doses. Adverse drug reactions usually happen in normal doses. If it's happened due to high doses, we call it toxicity. Okay. For adverse drug reactions, we have, I think you are familiar with the types of adverse drug reactions. We have type A, B. Actually, there are more than two, but this is the main two types of adverse drug reaction. Type A, which is related to the pharmacological effect of the medication. For example, anticholinergic medications are well known to have to cause dry mouth and also other anticholinergic effect. Because we know that because of the receptors this medication may lead to such kind of side effect. But type B is bizarre. We cannot predict. This is depends on the patients, like the allergy to penicillin. You cannot expect that allergy to penicillin may happen in this patient, in a particular patient or not. It's rare, less frequent than type A, but more dangerous. Clear so far?
Clear, doctor.
Clear, doctor.
Okay, fine. Sign and symptoms. Sign and symptoms are presentation. The clinical presentation of a disease or any condition. Usually signs, something that we can measure. Symptoms are what the patient is suffering. For example, if the patient, I feel nauseatic, I feel that I want to vomit, this is usually symptoms. Signs, something you can see. For example, red eyes, uh, or palpitations, high blood pressure. So this is sign of a medical condition. Okay. Complication is a secondary disease or condition that develops while a primary disease is there. This is either because of the disease itself or due to other independent cause. To simplify it, if the disease is not well controlled, usually it leads to complications. For diabetes, for example, if it's not treated well, it's well known to lead to renal impairment. So this is one of the complications. Also, students confuse between complication and sign and symptoms. Okay, renal impairment is not sign or symptoms of diabetes. This is a complication of diabetes. Sign and symptoms like, for example, thirsty and also frequent urination. This is the sign and symptoms of diabetes. But renal impairment, retinopathy also, this all complication of diabetes. Monitoring evaluation we mentioned in the slide before. Now the important point is the drug-related problems. What are drug-related problems? In fact, drug-related problems is an event that involving the drug therapy that may interfere with the desired health outcomes. Okay, anything related to a medications and that interfere with the target plan, your target plan, the patient's condition, this is considered as drug-related problems. We will see in details. I uploaded to here because iTalim today was not functioning. I uploaded here in the Microsoft team 2 files about the drug-related problems, or we call them also pharmaceutical care issues. In fact, there are several classifications of PCIs or DRPs. And also it's controversial whether we can use the same terms for the same meaning. In general, they said PCI is a wider term and an umbrella for any problem with the patient. Drug-related problems are part of pharmaceutical care issue. So we'll start with first one, untreated indication. If the patient has a problem, let's say asthma, but the patient is not on any medication, so this is considered a drug-related problem. Although the patient is not on medication currently, so don't get confused when we say drug-related problem. Does not mean that this patient should be on a medication to say that this patient now having DRP. Okay, the patient has a condition which require a medication, but this medication was not prescribed, so it is considered as drug-related problem. Now, the second one is if the patient is on a medication. Now, first question is this medication indicated or not? Is it correct to give this medication to the particular patient? If yes, okay, then ask yourself, is it appropriate? Is the selection of this medication is appropriate? We just mentioned an example of metformin in patient with advanced renal problem. If the patient has diabetes, okay, and in addition to advanced renal impairment, and the patient was prescribed with metformin. It's indicated by right, metformin is indicated for the diabetes, but it shouldn't be used in this particular patient because of other diseases, which is renal impairment. So this is improper drug selection. The third one is, okay, so the first question we ask is this medication indicated? The second one, is it appropriate to be used in this particular patient? If yes, we will move to the third question. Is the dose correct or not? Whether this is subtherapeutic or overdosing. Subtherapeutic meaning you give lower than therapeutic doses. Overdose more than therapeutic range. Fifth one is if you, okay, we ask the question, the medication is really indicated, there is no contraindication, meaning the medication selection is appropriate, the dose also correct. Now the duration of the treatment, was it correct? Example, usually in acute condition, the duration of the treatment, especially in infections, in infections, so you have to give the medication 7 days, 10 days, whatever. In some cases, you will see that this medication used only for 3 days. But on the other hand, also in some condition, you will see that this antibiotic has been used for more than 2 weeks or 3 weeks. But if you refer to guidelines, the duration is 7 days. So this is improper drug, incorrect duration of treatment. The sixth one is adverse drug reaction. So we ask again, you have to be very familiar with these DRPs and you have to memorize by heart, because this is later, inshallah, so you will automatically, just without counting 1, 2, 3, automatically will ask yourself when you receive any patient, is this medication indicated? Was it given in incorrect dose? And also the duration, was it correct? Is there any other diseases that consider as contraindication for this medication? And then you have to ask whether the medications has any side effect. After that, you will ask also if there is any drug-drug interaction. So the medication is indicated, and also it was prescribed with the right dose, and also the duration is correct. There is no adverse drug reaction, but maybe there is a drug-drug interactions. Here also you need to know that not all drug-drug interactions are clinically important. If you open any reference, BNF for example, or Medscape drug-drug checker, you will see a lot of drug-drug interactions. But do we need to take actions for all these drug-drug interactions? No, unless they are clinically important. And the reference will clearly state whether you need to take action or not. If you need, for example, to reduce the dose of one of them of the medication, or no, avoid concomitant use, meaning you have to stop one and continue only with the other one, and change to an alternative for the second medication. So Drug-drug interactions is important, but not all the time are clinically significant. The number 8 is, now everything is fine with this medication. It's indicated with the proper dose, no drug-drug interaction, no adverse drug reactions. Okay, but still the goal was not achieved. Backing to the example of diabetes. Diabetes, okay, this patient was newly diagnosed with diabetes. So the first option usually is metformin. You give metformin and then you monitor for this patient. After when you see the patient for the second time, you see that the patient blood glucose is still high. Of course, you need to ask whether the patient is really adherent to their medication or not. Of course, assuming that the patient is adherent to medication and also know how to use the medication very well, but still the blood glucose is not controlled. In this case, meaning there is a failure of treatment or insufficient treatment. So we may continue with metformin, but in this case, we need to add another medication. So you need to add on therapy. The last one is opposite to number one. On number one, untreated indication. Number 9 is drug used without indication. Okay, and these also are frequently seen in primary care in KK. Patients come to KK with a list of medication. Some of these medication are no longer indicated in this patient. Okay, you may see patients who are on proton pump inhibitors for months or maybe years, but it was indicated for a condition with this patient, but currently it's no longer indicated. However, the patient is still on this medication. This is, of course, inappropriate and considered a drug-related problems. Are there other drug-related problems or PCI? Yes, but these are the main drug-related problems. For example, other can be considered, as I mentioned, a pharmaceutical care issue, like the dosage form is inappropriate for a patient given IV instead of oral. The patient is unable to take the medication because either he does not know how to use the medication or unable to use the medication, unable to swallow, unable to inhale. It depends. Okay. So that's related to the pharmaceutical care plan. Okay. When you list the patient problems out of this problem, when we say problems, any medical condition, diabetes, asthma, fracture, whatever, out of these problem, you have to extract drug-related problem or pharmaceutical care issues. The last part in this introduction is the case report. This is applied for the hospital visit. After a hospital visit, you are required to write a report. This report, what are the components of this report? First one is the patient demographic information. Okay, this is applied not only in the hospital, even in primary care, like in clinics or even at your pharmacy. You need to take these information. First one is the patient demographic, race, gender, weight, and also the chief complaint. What is the chief complaint? Why the patient come down to the hospital? What is the main problem? Okay, shortness of breath. This is now the title of the condition. The chief complaint in this patient is shortness of breath. The second one is history of presenting illness. Okay, don't get confused between 2 and 3. 2 is the shortness of breath. Just only describe what is the problem. Just name it. Shortness of breath. So this is the chief complaint. History of presenting illness is when did this started? Okay. For example, the shortness of breath started a week ago, and also it's exacerbated when I run or when I sleep. So all these considered as history of presenting illness. Okay? But chief complaint is only the name of the problem. Past medical history, surgical history, past medication history, the patient medication, current medication, or even past medications. Familiar history is important, may be considered a risk factor for some diseases like cardiovascular diseases. If the patient having familiar history of a parent, sibling who past of cardiovascular, social, occupational, and allergy history. Maybe later we'll discuss what we mean allergy. Some patients may claim they have allergy to particular medication. Allergy should be differentiated from side effects. Okay? We mentioned we have two types of adverse drug reaction. One is type A, which is related to pharmacological effect of a medication. But B, which is considered as an allergy. So patient may say, I am okay, I have an allergy to penicillin. So if you ask the patient, what happened when you was given penicillin? He said, may I feel, for example, nausea, vomiting. This is not an allergy. This is a normal or type A side effect. Review of the system and laboratory of of the patients. Usually the laboratory investigation you can find from the patient chart. Here we are talking, of course, about hospital setting. Diagnosis also usually updated from day to day. First, there is impression, and then after that, until reach the final diagnosis. The medication in the ward, and then from the medication in the ward, the medication in the ward supposedly should treat all the problem with the patient. But sometimes these medication in the ward, some of them are not correct. Some of them have DRPs. So you, as a clinical pharmacist or now students, you need to extract these DRPs. And then you need to give a solution for this DRP. In other words, you have to prepare pharmaceutical care plan. This includes solutions and recommendation, of course, based on a valid reference. You have to try your best to use up-to-date references, especially guidelines, okay? And other textbook or online. When you refer to an online, you have to know what are the websites that are reliable and you can depend on taking an information and other unreliable sources. The last one, the references. So I think that's all related to an introduction in uh, pharmacotherapeutics 1. So if you have any question, please let me know. Any question, brother, sister?
Doctor, for
Okay, okay.
if the drug
Yes, sister?
for the drug that we have to be caution, the caution drug for the pregnant lactation. So like you said, we have to be cautious when want to give to the patient. So if there's some the patient show side effects, so we should immediately stop the patient.
Yes.
Sorry.
So for the
So the
caution,
patient,
yeah, for the caution, you can give the medication, but you need to monitor. If any serious side effect happens, okay, so you should stop the medication. If it's only cause tolerable side effects, you can continue. This is again frequent, for example, in elderly patients. You give a medication, this may cause nausea for these patients or dizziness. So you have to be cautious about that. You have to educate the patient. Be careful if you are dizzy, don't walk because this may lead to fall, and falls lead to fracture. So this is caution. Okay. Pregnancy depends on the classification of the medication. For example, if it's class A, B, usually it's generally safe to be given. But if it's class C, okay, it may cause side effects. It may affect the fetus. In this case, of course, you cannot monitor whether there is any side effects happen to the fetus, but depends on this, the list. C meaning use only if the benefits you expected, the benefits outweigh the risk. Okay. But cautions usually general term to be used in particular special population. Have I answered your question?
yes, doctor. Thank you very much.
Okay. We have also another question from, I'm not sure whether this is the same one, the point 3 of drug-related problems. Number 3 of, same one, caution, same question. Any other question? Brother, sister? Okay, please read the files that are uploaded to Microsoft Team, and also inshallah I will upload to iTalim when it's available. Okay.
Okay, doctor.
Okay, another important notes I give to my students for the first time I met them. Okay, uh, usually there are two comments about me from the student side. Okay, the first one is about my slides. My slides, they may be too wordy. Okay, there are a lot of information in my slide. Why I do that actually? Of course, while presenting, I don't read line by line. I just highlight the most important point. Okay? But because I know most of the students, if I refer them to a reference, they will not read. They only read our slides. That's what usually happens. If I just put the most important point and then I refer you to pharmacotherapy handbook, and I ask you to read from the pharmacotherapy handbook, and this is required for the final exam. I doubted that the students will go and read from the reference. Because of that, I try to include all information needed in my slide. I does not mean that my slides are sufficient to have a very comprehensive knowledge about a particular. No, but at least it have the most important and basic information at this level, I believe are enough. So, okay, don't be scary if you see my slide, but usually, inshallah, I would like to simplify and highlight on the most important thing. So this is usually the first common comments I receive from the students, but usually after I explain this from the beginning, now the student understand. So mainly I will no longer usually receive this comment. The second one is maybe funny, but they said I don't smile very frequently. There's nothing against you, students. You are like just my brother and sister, but this is maybe my facial expressions. That's all. So hopefully, inshallah, we will go in this journey very smoothly, and everybody will be fine, inshallah, related to PT1. As we created the WhatsApp group, okay, if you have anything you believe it's important, you can put in the group. I have now scanned read. Okay, let's read the comment. Doctor, we know that antibiotic has side effects such as diarrhea and vomiting. What if the patients came and saying that they can't bear the side effect? Should we change the meds to other Yes. If the patients cannot tolerate the side effect, okay, and you have a safer alternative, okay, you can go to a safer alternative. But if you believe this is not a severe diarrhea, okay, so can be tolerated by the patient. But if the patients and this side, especially if this side effect lead the patient to refuse taking the medications, okay, so of course you have to change. Usually side effects depend on the patient. Some patients are very fine with just abdominal disturbances, for example, of metformin, but others really cannot use metformin because of abdominal side effect, okay? In this case, you may either change to extended release metformin may help, or you may go to an alternative. Another question from Siti Hajar. In a drug adverse reaction type A, it is dose-dependent effect, yes. How do we differentiate it from toxicity? Very good question. In fact, there are an overlapping between toxicity and side effects. But if we may be more accurate, okay, toxicity when you give the patients the medication above overdosing, or if the patient has a condition that require you to give lower doses, like for example in renal impairment. In renal impairment, even if you give normal doses for any individual, this may lead to toxicity because of the accumulation of the medication in the body. How to know that? To be very accurate, but this is not applicable to all medication. To know whether these side effects or if this is kind of toxicity, you need to measure the blood level, the drug levels in the blood. Okay, whether it's still within therapeutic range or beyond therapeutic range. This later you may see in clinical pharmacokinetics, inshallah, in year 4. Okay, but to be honest, also some references may refer to side effects as kind of toxicity. Okay, but some differences differentiate between toxicity and side effect, and also I am with that. Okay, toxicity happens when there are serious side effects and usually associated with supratherapeutic ranges in the blood. Hopefully I also answered this question. Doctor, this is a suggestion. If iTalim is not working, I think you can send the lecture note to person in charge. Okay, no problem for providing the slides, whether it's on iTalim or here. Okay, I will try to put the materials on both platforms, iTalim and Microsoft Teams. Okay, the recording of this one now I will put on the drive, on the Google Drive, and then send you the link. Any other question? Okay, if no, thank you so much. Stay safe. Okay, see you tomorrow, inshallah. Okay, assalamu alaikum wa rahmatullah.
Thank you very much,